And now, please experience walking like a hemiplegic patient. I hope that you walk exactly like you saw these patients to walk. And I see from the chat group that you are eager to learn more, but be patient. You really need to do all these steps that you will understand the whole thing, because Vasa concept is such a huge thing and there's so much theory. And you need to experience things with your own body and with patients' bodies that you can understand this whole thing. And when you have walked like this hemiplegic patient, I would like to hear answers to these questions. That what muscles are you using? How is your foot? Is it totally against the ground? How is your knee? How is your pelvis? Where does it hurt? And after walking a while, like 5 to 10 minutes, where is your arm? Does it rise up? Even your hand is not bleeding. Have you thought about this? That your arm is rising, even it is not bleeding. Have you thought about this? How the arm is rising in a synergy grouping? And what about the proprioception? What happens when the lower limbs is not totally on the ground and the body weight is more on the better side of the body? What kind of information are you having from your body? So, ear rating affects in this walking. Good, you are answering also to this. Yeah, someone was asking there's something that not putting weight on the affected side. Yeah, that is on the way you need to walk. I'm waiting for some answers in there so I will know that you have done this, because we cannot wait now 5 to 10 minutes, but I hope that you are doing it even for 1 minute, and after our session you will do this like 10 minutes. And if you are doing this 10 minutes today, tomorrow you will understand so much things, and you will understand the next slide. But before that, abnormal pattern occurs because of unloading the limb. Yeah, that is true. Yeah, and it was good point from the earlier video that patient is pulling his affected body by normal side body. That's true. Yeah, and circumduction. Remember that when you are trying to walk like hemiplegic patient. Yeah, and then they are tracking the affected leg. Good, you are doing this. And if you are doing the exercise 10 minutes today, you will know the answer for this tomorrow. So, where it usually hurts? Usually there is spastic pain in the upper limb. There's pain in the ribs and lower back. and there's pain in the whole lower limb. And usually they are also pain in the toes, and the toes are glowing. But if you do this exercise, you will understand how much there is pain in the better side of the body, because it is doing the most of the work. It is hard to push and pull the other side of the body when you are walking. It's very good. Someone write there that even at spinal level there's inequality. Inequality. Very good. And when you are doing this K training exercise, remember that usually there's the poor proprioception, so eyes are watching on the ground, and which can give the neck pain. So I hope that tomorrow when we are continuing, you write something about this exercise. That you have tested with your own body, because I hope that every time when you are having the patient, you are walking like that patient. Then you are getting so much information about how you can help that patient. But then, can we do something better? And now I'm getting a little bit back for the man who was using the cane, walking on the video. What is the difference on hemiplegic side? What is the difference on foot, knee, hip, pelvis, trunk, arms, in the whole body? What is the difference on COM? And is it more safer or not? And here is video from a man who is using a cane, but he is walking with knees bent. And I put the video again, so you can see that there is no splint on the leg or the arm. And the arm is just hanging, it is not rising up. And the reason might be that he is walking knees bent. And it would be nice if we would be able to get the man who was on the video and ask him to walk knees bent. What would be the difference? Could he walk without the splints? Somebody said that this is not safe. Let's watch again. How come this is not safe? Or it was on some other video. But walking on knees bent, at least for me, this is looking much more safer than locking the knee. Yeah, there's less fear of fall. Very good. We are talking, I think, tomorrow about fear of falling. And now there's a next exercise for you. And you have said there that it looks less asymmetrical. And now I hope that you experience walking like a hemiplegic patient with knees bent. So you can see how it is different, how you can make a change with little correction, and how it's changing the whole body only by bending your knees. And when you are experiencing, think how it changes, what muscles you are using, Does it change how your ankle or foot is? Or is your foot more against the ground? And does it change something on the pelvis area when your knees is bent? And where is your center of mass when you are walking on knees bent? And after walking a while, is your arm rising? With this video, what we were seeing, the man who was walking knees bent, the pledgic hand was totally relaxed. And hopefully that also happens to you when you are walking like a hemiplegic patient, but knees bent. I'm just checking the chat once again. You are doing good work in there. You are seeing now how little things can affect a lot. It would be nice to do this exercise once again, like 10 minutes. But I hope that you will do it after our webinar. Good. Many has noticed that there is less fear of fall. This is very good because then it's easier to continue from that tomorrow.